encouragement, we have continued it. So thank you very much and welcome to all the Facebook Live parents. We welcome you to the journey of online education and engagement. We have been meeting you frequently every week, invariably since about 1.5 years. This journey of online engagement has started about 1.5 years back. Every week we come out with new topics, new speakers, and a knowledge sharing experience through Facebook Live. And our objective is our parents, our students, our teachers, and all the viewers who are watching this program today live or maybe in future also, they should gain some knowledge, they should gain some experience, and they should understand what is going on in the society today. And the best part is we have got so many good people associated with us, and they always come forward with some interesting topics which are needy, which are required to understand, and for which always parents are open to learn something. So today we have got a topic: dental hygiene and awareness, kids and adults. So dental hygiene, this is a time where we talk about a lot of hygiene, whether it is washing our hands or keeping our place clean or wearing mask or sanitizing ourselves. And at the same time, the hygiene is also taking one step extra, and that is about dental hygiene and awareness. Now, when we say for young kids to the toddlers to the matured kids or students or the children or the adults, we always focus on the part which we can see it externally. The teeth is always a part which is rarely seen outside, only when we smile, and that too this part. If we understand it very critically, the smile is always a value of a person. And if your smile carries good with dental hygiene, your value of the impression will be always greater than it was in the past. So we have today to share their experience, knowledge, and understanding about dental hygiene and awareness with kids and adults, focusing Dr. Shaleen Shah, who is pediatric dentist, and Dr. Pooja Shah, who is also a dentist. And I'm Unmesh Dikshit, your moderator, welcoming you once again to Delhi Public School Bhopal Facebook Live. Dr. Shaleen Shah is MD in pediatric child dentistry. He completed his graduation from Asia's biggest civil hospital, Ahmedabad, and he has an experience for about 8 to 10 years now. And Dr. Shali is also specialist in pediatric orthodontist, means treatments of crooked teeth and children with or adults. And Dr. Pooja Shah is general dentist who completed her bachelor's degree from well-reputed dental college of Visnagar, and she is specialist in root canal treatment and is also a cosmetic dental treatment surgeon, doctor. So welcome Dr. Shaleen Shah and Dr. Pooja Shah to this Delhi Public School Bhopal Facebook Live.
Thank you, sir.
Thank you, sir.
Thank you very much for joining, and thank you very much once again for all the parents, students, teachers who have joined Facebook Live. We welcome you once again for the Delhi Public School Bhopal Facebook Live. So, Dr. Shali, let me ask you one simple general question, because I am also a person who doesn't understand the importance of dentistry, the field, or importance of oral hygiene. Why is it that people do not focus on this part of understanding, and why people don't focus on this part as a routine practice? क्यों बताना पड़ता है उनको?
सर इसके ऊपर ना मैं ये चीज बोलना चाहूंगा कि हमारे वहां एक बस प्रैक्टिस है कि सुबह उठ के ब्रश कर दिया, बस वो अपने दांतों की सफाई हो गई. सो इट इज नॉट ऑलवेज लाइक दैट कि दांत की सफाई कर देना सुबह में वो एक बस खत्म हो गया काम. वो पहले से ही अगर उसमें आदत में डाला जाए, जैसे कि सुबह और शाम 2 टाइम ब्रश करना है, खाना खाने के बाद प्रॉपर कुल्ला करना है, एंड एवरी 6 मंथ्स डेंटिस्ट का विजिट करना है, वो सिंस चाइल्डहुड हमें इंट्रोड्यूस करना है. अगर चाइल्डहुड से हम इंट्रोड्यूस करेंगे तो ये पूरे लाइफ टाइम में हैबिट बन जाएगा, और वो ओरल हाइजीन का जो पार्ट निग्लेक्ट हो रहा है वो निग्लेक्ट नहीं.
करेक्ट. सो डॉक्टर साहब ने बहुत अच्छी बात बताई दैट फ्रॉम आवर चाइल्डहुड डेज वी शुड बी ट्रेन्ड as a child. So that is a role of a parent, that we need to train our child that it is not only about cleaning your teeth in the morning or at night while sleeping. It is about overall hygiene, which is important, which we need to maintain all throughout the day, and that is how you maintain the life of the teeth, or the best part of the teeth which is available to you all throughout your life. So, Dr. Saab, one more question to you, Dr. Pooja. You are also a mother.
Yes, sir.
If you can answer Dr. Shalin's question or concern, that why parents are not focusing on this. You are a doctor, you are a dentist, but I am asking you as a mother, why do the mothers do not focus on this part particularly?
As a mother, I only can say that right now we all are working mothers. Majority of us are working mothers. So in morning we have our schedule very busy. So I think most of the mothers do not care their children, do not be able to guide their child properly how to brush, when to clean your mouth after eating sweet food. You have to gargle at night before going to bed. Also, you have to brush. I think in our busy schedule, we miss majority of this. So that is the main reason why nowadays children having very much dental problems since very small age.
Good. So thank you very much for an honest answer. As a mother, she is replying that every mother or majority of the mothers are working mothers, and that is how they don't focus on the child health care. So here is my submission, my request: all mothers who are working, all fathers who are working, please have a good teamwork with you as a father and mother. Support each other's time management and support the child so that your child is healthy by all means, and particularly for the oral hygiene, what we say at the dentistry part. So let me ask you some technical question, that how many milk teeth are there, and what are the ages or time where it needs attention or where it needs some medication, Dr. Shalin?
See, there are 20 milk teeth are there and 32 permanent teeth are there. So usually milk teeth starts coming by around 6 to 7 months of age, we can say, but sometimes it may come after 1 year also. So parents not need to panic if the tooth is not coming at a particular time. They just wait and watch, and if required only, they can take a guidance from a pediatric dentist, and all the teeth, all 20 teeth will come up to the age of 3 years. So in between 6 months to 3 years, all 20 teeth will be there, and these teeth will remain in the oral cavity up to the 12 years. It means by the age of 7 years, the tooth started going, and up to 12 years, it will be changing. So all my conclusion is that you need to take care of the teeth from up to 6 to 7 months of age up to 12 years. So milk teeth are that important.
Great. Milk teeth are very important, and there are about 20 milk teeth, and at different parts, different age, it needs an attention. So good evening to all the Facebook Live, those who have joined us. There are many parents, students, teachers who are wishing us good evening. So good evening to you all. And if you have questions, those who have been in the Facebook Live right now, which I can see it on my other device, if you have any questions, please write to us. I will talk to you as a moderator from your questions. I'll share it with Dr. Saab also. So, Dr. Saab, Dr. Shalin, are milk teeth important, or what is the importance of the milk tooth? Whatever way we can make our parents understand this.
Yes, very good, sir. Very good question. Sir, as per my experience is concerned, milk teeth are very much important in speech development. If any of the front tooth is missing, then words like the, all are coming from the your incisors, your front teeth. So if these teeth are missing or broken or decayed, then there is always difficulty in speech. Child should have a difficulty in speech for a longer period of time. Second thing, it is always important for chewing. And if the child's chewing is compromised, child's complete general health is lost. Like I have seen the children with the problem or dental problems, which are having the throat problems, cold and cough, all have digestion problems, all have stomach problems, and also they have thin and lean. They are not getting a proper body weight. They are not getting proper nutrition. So second thing, chewing is the most important part. Third is the smile. Nowadays also आप 3 साल के बच्चे को भी देखोगे ना, उसको भी एक स्माइल करके एक फोटो खिंचवाना है, सेल्फी लेनी है. तो अगर दांत अच्छे नहीं होंगे ना, तो बच्चे का सेल्फ कॉन्फिडेंस डेवलप नहीं होगा. और मोस्ट इंपॉर्टेंट थिंग ये है, टेक्निकल पार्ट हम देखें तो, कि प्राइमरी टूथ अगर उसकी पोजीशन पे सही से बैठे हुए है तो वो नए टीथ को आने में बहुत हेल्प करेंगे, और जॉ का ग्रोथ भी उसके ऊपर बहुत डिपेंडेंट होता है. सो मिल्क टीथ आर ऑलवेज एज इंपॉर्टेंट एज द परमानेंट वन, एंड इफ योर मिल्क टूथ डीकेड ना, then it may damage the permanent one also. So that is the most dangerous part. So always we cannot advise that even if there is smallest decay in the milk teeth, you should go and treat it.
Great. So nothing is small in dentistry or any teeth which
Yes.
requires attention at any age, that
Yes.
should be given priority at particular age. So
Yes.
Dr. Pooja, I would like to ask you the same question. When mothers of small kids comes to you, what kind of awareness they have or what kind of awareness they don't have, and they come to you with their kids as a patient?
In our routine practice, I always come to a contact with mothers who is very much conscious about their kids' dental health, and someone is like ये मिल्क टूथ है, गिर जाएंगे, नो नीड टू वरी, इट्स ओके, अगर छोटी सी कैविटी है, परमानेंट टूथ तो आने वाला ही है. सो जो मोस्ट कॉन्शियस है उनके लिए भी मैं कहना चाहती हूँ कि अच्छी बात है, आप इतनी अच्छी केयर करते हो, क्योंकि मिल्क टीथ आर वेरी इंपॉर्टेंट. बट जो लोग ये कहते हैं कि मिल्क टूथ है, गिर जाने वाले हैं, तो जैसे डॉक्टर शालीन ने बताया, इट इज वेरी इंपॉर्टेंट, वी हैव टू ट्रीट इट. ऐसा नहीं कि अगर आपको छोटा सा ब्लैक स्पॉट भी दिखे तो गो एंड ट्रीट इट, बिकॉज वो आगे जाके वो बढ़ेगा, कैविटी बड़ी होगी तो वो डैमेज ही करेगा. सो बेटर टू ट्रीट इट rather than ignore it.
Correct. So Dr. Shaleen, one question to you is how can we take care of our child's teeth, as it is very difficult for us to refrain the child from street food or some other types of food or drinking habits, because children are children. So how can we balance it?
Yes, sir. This is a most important question. I can say it is $1 million question, because each and every person or each and every patient coming to me ask me the same question. So see, it is. I also believe that it is not possible to refrain a child. Even myself also. I also like sweets. Some कोई मुझे chocolate देगा तो मैं भी खाऊंगा. Obviously, it is a thing that sweet food is liked by everyone. So sweet food खाने की एक टेक्निक होती है कि जैसे लोग बोलते हैं कि भाई बच्चा सर इसने तो चॉकलेट खा के दांत सड़ा दिए. ऐसी बात नहीं. चॉकलेट खाने से दांत नहीं सड़ते. चॉकलेट दांत में फंसी रहने से दांत सड़ते. कोई भी स्वीट फूड अगर दांत में फंसा रहता है तो दांत सड़ता है, and it will also take 20 minutes. So definitely you have a very good 20 minutes time to clean your teeth. So अगर आप बच्चे को कोई भी स्वीट फूड देते हो, अगर आप बच्चा कोई भी स्वीट फूड खा लेता है, तो not to worry, just clean his teeth, and it is always better to brush it after giving a sweet food. Now question ये आता है कि सर हर बार वो चॉकलेट खा के ब्रश कैसे करेगा, तो वो भी एक important valid point है. तो बच्चे को चॉकलेट खाने की हैबिट या तो स्वीट फूड खाने की हैबिट उस टाइम पे रखनी चाहिए कि जब वो खाना खा रहा है, जैसे एक मील ले रहा है, उससे पहले उसको स्वीट फूड दे दो, उसको एक हैबिट डाल दो, तो उसके मन में ऐसा हो जाएगा कि नहीं भाई मुझे चॉकलेट तो मिल रहा है पर मुझे स्पेसिफिक टाइम पे खाना है इसे. तो अगर वो खाना खाने से पहले चॉकलेट खाएगा तो खाना खाने के साथ वो चॉकलेट मुंह से वॉश आउट हो जाएगा दांतों से, और वो दांत में चिपका नहीं रहेगा. सेम वे अगर कोई बिस्किट वगैरह है, जैसे स्वीट बिस्किट है, क्रीम बिस्किट्स है, उसके साथ साथ आप वेफर्स वगैरह दे दो, तो आप फर्स्ट ही हैज टू ईट द बिस्किट, देन ही कैन ईट द वेफर्स और पॉपकॉर्न्स और व्हाटएवर द क्रिस्पी फूड इज देयर और स्पाइसी फूड इज देयर. So it will not allow the chocolate to stick on your teeth. Even some vegetables, raw fruits are also there, which can easily take out or wash away the chocolates from your teeth or grooves of the teeth. So they should be the best option. I think they can manage.
Correct. Any particular case study, Dr. Shaleen, where a small child of say 5-7 years have come and you have overcome with some surgery or some bigger problem, and
Yes.
that child is safe now?
This bigger surgery means there is not that is that life-threatening surgeries or life-saving surgeries, but yeah, we have seen that all 20 teeth are decayed or 20 teeth are decayed up to the root level. So we need to treat them all, everything at a single go. So this type of things are possible where like milk habit, night milk habit is there. रात को दूध पी के सो जाते हैं बच्चे, बॉटल वाला दूध पी के सो जाते हैं, उसमें चीनी डाला होता है पूरा, तो वो पूरा स्वीटनर होता है, तो इट विल अफेक्ट द होल टीथ एट अ टाइम. अगर रात को मुंह में पूरा दूध रहता है वो शुगर वाला, तो वो सारे दांतों को एक साथ अफेक्ट करते हैं. देयर आर लॉट्स ऑफ केसेस आर कमिंग, नॉट अ सिंगल केस. 2 years 3 years के बच्चे में all 20 teeth are decayed. We have seen like this. It is called as rampant caries, or nowadays it is called as a early childhood caries. That is a little bit dangerous situation, because उसमें मैंने जो पहले बताया कि deciduous tooth नहीं होने से या फिर decayed होने से जो प्रॉब्लम होते हैं वो सारे उसमें हो जाते हैं, और बच्चे का ओवरऑल हेल्थ कॉम्प्रोमाइज होता है, उसका सेल्फ कॉन्फिडेंस कॉम्प्रोमाइज होता है, अल्टीमेटली उसका स्टडी वगैरह भी कॉम्प्रोमाइज होना शुरू हो जाता है. सो ऑल थिंग्स आर दैट कि अगर decayed tooth है तो lots of problems will come after that.
Correct, correct. So 2-year-old child can also have a problem. Up to any age, these problems can be there.
Yes,
So,
yes.
Dr. Pooja, for adults, what is your advice if they have some particular cleaning habits or washing their teeth habits? What should be the routine of a mother and father which children will see it and observe it and then follow it also?
यस सर, आई वुड लाइक टू टेल कि हम लोग सुबह उठ के जो ब्रश करते हैं ना, वो पर्टिकुलर कोई लोग बोलते हैं मैं तो 15 मिनट ब्रश करता हूँ फिर भी मेरे टीथ में कैविटी है. जो रूटीन पेशेंट्स आते हैं, मैम बहुत जल्दी कैविटी हो जाती है, मुझे तो बहुत अच्छी तरीके से ब्रश करने की आदत है. बट मुझे उन लोगों से कहना है कि आप 15 मिनट करो चाहे आधा घंटा करो, आप अगर प्रॉपरली ब्रश नहीं करोगे तो देयर इज नो मीन. अगर आप विग्रसली ज्यादा जोर से भी ब्रश करोगे देन विल आल्सो योर टूथ इज गोइंग टू डैमेज. तो ब्रशिंग हम जो करते हैं वो ब्रशिंग टेक्निक ही प्रॉपर होनी चाहिए. सुबह उठ के और रात को, आजकल हम लोग इतना बिजी है कि हमें प्रॉपर ब्रश करने का भी टाइम नहीं मिलता है. उठता है, फटाफट ब्रश किया और बस हो गया हमारा ब्रशिंग, दांत क्लीन हो गए. नहीं, ऐसे नहीं होता. जो भी खाना फंसता है वो प्रॉपर ब्रशिंग से ही निकलता है, अदरवाइज वो दांत पे स्टिक ही रहेगा तो कैविटी तो होनी ही है. So I would like to explain about the right brushing technique, sir, if you allow.
Yes, yes.
Yes, sir. So मेनली हम सबका यही है कि हम लोग सुबह ब्रश जल्दी जल्दी में आते तो सो ही रहते हैं, ब्रश लेते हैं और ऐसे घिसना शुरू कर दिया, बस हो गया. सब मेजोरिटी 50-60% तो ऐसे ही करता है, बस ऐसे घिस दिया हमारा ब्रश हो गया. बट नहीं, दिस इज वेरी रॉन्ग. और स्पेशली व्हेन यू आर डूइंग इट वेरी विग्रेसली 15 मिनट, देयर इज नो मीन आप अपने दांत डैमेज ही कर रहे हो. प्रॉपर ब्रशिंग टेक्निक ये है, आप सिर्फ 3 मिनट्स ऑफ प्रॉपर ब्रशिंग टेक्निक इज इनफ. जस्ट पुट योर ब्रश लाइक दिस, और ऐसे हॉरिजॉन्टल तो बिल्कुल भी नहीं करना है, ये हमारे दांत को डैमेज ही करेगा. द करेक्ट टेक्निक इज यू हैव टू डू ब्रशिंग अप एंड डाउन लाइक दिस वे, up and down or in a circular motion, but no horizontal strokes. Horizontal strokes से डैमेज होगा. up and down and round and round. और मेजोरिटी क्या करता है, सिर्फ ये वाली सरफेसेस क्लीन कर देता है, मुंह खोल के अंदर की सरफेस की तरफ तो कोई ध्यान ही नहीं देता. जैसे ये हमारे ऊपर के है, और सेम वे इनसाइड ऑल्सो. दैट पार्ट इज एज इम्पोर्टेंट एज, जैसे हम आउटसाइड जो बाहर दिखने वाले वो नहीं, कैविटी अंदर से ही होगी, तो हमें अंदर से भी इतनी ही अच्छी तरीके से क्लीन करना है अपने दांतों को. सो प्रॉपर ब्रशिंग टेक्निक इज वेरी इंपॉर्टेंट. अगर आप अच्छे से ब्रश कर रहे हो, पूरी सारी सरफेसेस क्लीन हो रही है, तो 50% तो आप वहीं से ही अपनी कैविटी को स्टॉप कर रहे हैं.
Great experience. What demonstration you have done, and it is a learning experience for us. Our Facebook Live friends who have joined, they are also giving a good thumbs up that it is a good learning. I can watch it from my another mobile device which I am observing them. So friends on Facebook, please ask questions to Dr. Shaleen and Dr. Pooja Shah if you have any. So Dr. Shaleen, if we understand that this particular area is very much unknown to the parents or anybody,
Yes.
how do we convince them for this, and what are the different advanced technologies available nowadays to prevent this dental decay?
Yes, sir. Sir, nowadays people are saying that, sir, my child is eating lots of chocolates because chocolates are now available very easily. But I can say that there are, on the contrary, there are against advanced technologies are also that you can protect your child's teeth, right? So there are mainly the Pitt & Fisher sealants and fluoride application. In the simple word, I can say it is a vaccination of the tooth. सो वैक्सीनेशन ऑफ द टूथ मींस लोगों को ऐसा लगता है कि कोई इंजेक्शन डालेंगे, पर ऐसा नहीं है। ये एक वैक्सीनेशन ऐसा है कि जिससे सडन होने के चांसेस 80% कम होते हैं। चाइल्ड टूथ में 80% रिड्यूस करते हैं वो चांसेस। तो वो क्या है, जैसे आप कोई भी दांत देख सकते हो, ये दांत है, ये पीछे का मोलर है जो चूइंग सरफेस है। जैसे मैडम ने बताया चूइंग सरफेस को हमें अच्छे से क्लीन करना है, बिकॉज चूइंग सरफेस में ही मोस्ट ऑफ फूड लॉजमेंट होता है। So what we are doing at an early age, we have a special material known as a Pitt and Fisher sealants. So वो हम इस फिशर्स में फ्लो करवाते हैं और उसको क्योर कर देते हैं, मतलब सील कर देते हैं, ताकि उसमें कोई खाना फंसता नहीं है और वो इजीली वॉश आउट हो जाता है। जैसे मैंने बोला चॉकलेट फंसी रहती है तो सडन करती है, ये फिशर्स हो गई नहीं तो चॉकलेट फंसेगी नहीं, चॉकलेट फंसेगी नहीं तो सडन नहीं होगी। So this is the first and very much important thing which is called as a Pitt and Fisher sealants. And you have to go for it at 3, 7, 11 and 14 years of age. These are the time period where you can do it. No doubt ऐसा नहीं है कि यही टाइम पीरियड में हो सकता है, ये कोई भी कर सकता है up to 15 years. But these are the best period 3, 7, 11 and 14. And ये Pitt and Fisher occlusal surface मतलब चबाने की सरफेस को सील करेगा, और उसके बाद एक मेडिसिन आती है जिसको फ्लोराइड बोलते हैं, तो वो फ्लोराइड उसके ऊपर की सरफेस को सील करेगा ताकि बाकी कोई भी सरफेस से कैविटी नहीं हो और सरफेस को स्ट्रेंथ मिले। तो पिट एंड फिशर सीलेंट प्लस फ्लोराइड जब हम अप्लाई करते हैं बच्चों के दांतों में, तो डेफिनेटली आई कैन से इट इज 80% प्रोटेक्शन। एंड डेफिनेटली वी हैव सीन इन आवर रूटीन प्रैक्टिस कि आफ्टर डूइंग पिट एंड फिशर सीलेंट्स देयर इज अ वेरी वेरी लेस चांसेस ऑफ द डीके ऑफ द टूथ।
Great, thank you. Good learning. Good learning. I think Dr. Saab, you have got some internet connection error. Are you there? Can you listen us?
Yes, yes,
Yes,
sir.
sir.
Yes, sir. Our connection is fine.
Perfect, perfect. So internet errors are part of our life. Internet errors are a part of our life, and we have to adjust and accept it. So how can we take care of our child to prevent this crooked teeth? And what are the different treatment options available for the child for crooked teeth?
Sir, there are whenever there is your child, you are thinking about a crooked teeth. So there are lots of reasons for the crooked teeth, but majority is there are a few habits like thumb sucking, lip biting, mouth breathing. Yeah, means child keeps his mouth open while at night. So these are the major things which can lead to the crooked teeth. Also, if a milk tooth loss is earlier because of any reason, like due to the decay we have to remove it, or due to the trauma or due to the fracture it will be gone, then also it may lead to the crooked teeth. So whenever there is a problem of a crooked teeth, usually it is seen in the permanent one, and permanent teeth starts coming by around 7 years of age. So it is always advisable that after 7 years of age you should seek the dental checkup for the crooked teeth correction or any of the developing malalignment or any of the developing crooked teeth. It is advisable, and every 6 months after 7 years of age up to the 15 to 16 years, you should go for the checkup.
Great. So this is how all the parents and teachers and students should take care about their teeth. One more question: how to prevent sports dental injury? Because see, any school will have a lot of activities in the sports ground, and we have observed many sports activities facing dental injuries. So how to prevent that?
Yes, sir. Sir, many times we are seeing 8 to 9 years of child who has come with the trauma and broken central incisor, which will be lasting for his life. So it is always very much a difficult thing for a child to accept that my tooth is broken. Whenever he smiles, his colleagues are also making fun of him. And also it will lead to lots of complicated treatment when it fractures early. So we always prefer that you have to wear a sports guard. That is a simple device which he can wear in his mouth while playing. So it will protect his teeth. Like if he's playing cricket, he can have a helmet. If he's playing football, then there is no helmet in football, but we can have a teeth guard. You have seen in the hockey that people are wearing the teeth guard. So same way we can also make it for a child, and his teeth are remaining protected at an early age, because it is very important to protect it up to at least 10 to 11 years. Because after 7 years, it is also forming, its root is forming, and if it is injures at that time, it will lead to the lots of complicated dental treatment. So I always never prefer to go in the complicated dental treatment. but also we need is that a mouth guard or teeth guard, what we can say.
Correct. And this is how we can prevent the sports injuries or any other. Dr. Pooja, I would like to ask you, for students or teachers during the school environment or during the school hours, what are the other ways to be safe for not having any dental injury?
Yeah, during school hours and while playing outside also, I would like to say कि जो पंचिंग एंड ऑल आजकल के बच्चों को तो ये पंचिंग वंचिंग ये सब बहुत अच्छा लगता है, ये खेल जैसे दे आर प्लेइंग और एक मुंह पे मार दिया. सो नो, आई ऑलवेज से माय चिल्ड्रन, प्लीज प्रोटेक्ट योर माउथ, प्रोटेक्ट योर फेस व्हाइल प्लेइंग एनीथिंग, बिकॉज आपके अगर मुंह पे कुछ भी लगेगा ना तो टीथ एक दो तो टीथ थोड़ा तो फ्रैक्चर हो ही जाएगा अगर जोर से लगती है तो मैं हमेशा यही एडवाइस करूंगी कि प्लीज डोंट play any hard thing or always wear helmet or we have to make a habit to protect our face कि ऐसे विग्रेसली नहीं खेलना है कि आपको दूसरों को ऐसे पंच भी नहीं करना है, आपको अपने आप को तो प्रोटेक्ट करना ही है, बट डोंट हिट एनीबॉडी आल्सो, दैट आई कैन से.
Good. Doctor sir, there is one question, Dr. Shaleen bhai, if you can answer, how to reduce gap between milk teeth can be closed without braces? Dr. Komal Gangwani is asking.
Yes, see, अगर milk tooth में gap है, if there is a gap in a milk teeth, that is a good thing, because milk teeth are smaller and permanent tooth means is newer which are coming, it is bigger. So if there is a gap, you have to be happy because the new teeth will come, it will come in its position and there is no space deficiency for them. So it is always advisable to have a gap in a milk tooth.
And so can it be closed without braces?
See, if there is a gap in a milk tooth, it doesn't need to close. If it is a gap in a permanent tooth, yes, then we should wait it up to 13 to 14 years of age. It may close by itself, but if doesn't close after 13, then we should seek for a dental advice.
Correct. So this is how we are replying to Dr. Komal Gangwani. She is on Facebook Live and she has asked a question. Hope you are satisfied with the answer. So all the parents, students, teachers, if you have any questions, you can ask us. We will be live for some time right now. So Dr. Saab, if you can recap top 5 things to be done for the dental hygiene or oral hygiene for kids and for adults, what are they expected to do?
Yes, definitely, sir. This is a very good question. Sir, first of all, I would advise to brush twice daily with a proper fluoridated toothpaste or any pediatric dental toothpaste. All are fine. So please don't ask any questions from the audience that which toothpaste is good. See, there is lots of options, but all are fine. There is no specific toothpaste is there. But yes, you should use a fluoridated toothpaste and you should use it 2 times a day. Second thing, always go for a dental checkup with a pediatric dentist every 6 months. Without fail, whether your dental problem is there or not, you should go for a dental checkup at every 6 months, right? Third one is that always go for the vaccination of the tooth. Vaccination is the must, which will reduce the 80% of the decay. 80% is means a lot. 80% of decay reduced means you have almost nil dental decay, we can say. And fourth one is that always eat a sweet food before meals so that sweet food should not stick to your teeth. See, these are the main points or main recap points from our talk from my side.
Good. And Dr. Pooja, as a mother, 3 important points for a mother to take care about the children at home.
Yeah. Sir, I'm about to say, as my son is nearly 6 to 7 years of age, most of the mothers ask me this kind of question. At the age of 6 to 7, now it's the time when the male tooth is front male tooth are going to shed. वो अभी गिरने का टाइम है और नए permanent tooth, especially incisors, they are about to come. तो कभी कभार क्या होता है बच्चों में milk tooth आगे का गिरा नहीं होता और अंदर की तरफ से permanent tooth आने लगता है. So majority of the mothers ask me कि if in this kind of case, what should we do? तो मेरी यही सजेशन है कि अगर आप यू कैन सी कि ओरल कैविटी में परमानेंट टूथ अंदर की तरफ से आ रहा है और ऊपर का मिल्क टूथ अभी गिरा नहीं है, तो बेटर टू विजिट अ डेंटिस्ट और मिल्क टूथ का एक्सट्रैक्शन करवा लीजिए, बिकॉज वो जो अंदर परमानेंट टूथ आएगा ना, वो टेढ़ा मेढ़ा एक क्रुकेड ही आएगा फिर, और वो अपनी पोजीशन पे सही जगह, जहां मिल्क टूथ की जगह परमानेंट टूथ को आना चाहिए वहां पे वो नहीं आएगा, उसकी जगह वो अंदर की तरफ या साइड में आएगा। तो बेटर है कि उसके उसके आगे का जो मिल्क टूथ है वो हम एक्सट्रैक्ट कर ले, ताकि उसको जगह मिले अपनी नेचुरल जगह आने के लिए। द फर्स्ट थिंग इज दैट कि रेगुलर विजिट तो करनी है डेंटिस्ट से। एंड द सेकेंड थिंग इज प्रॉपर ब्रशिंग टेक्निक। बच्चों में बहुत ही इंपॉर्टेंट है ब्रशिंग, स्पेशली नाइट ब्रश, बिकॉज पूरा दिन वो कुछ ना कुछ ऐसे स्वीट और कुछ खाते रहते हैं और फिर रात को सो जाते हैं, तो वो पूरा मुंह में रहता ही है। तो बेटर है आप नाइट टाइम ब्रशिंग की हैबिट तो डलवा ही लो कंपलसरी। उनको एक अपना शेड्यूल बनाना ही है कि बिफोर गोइंग टू बेड वी हैव टू ब्रश। और थर्ड थिंग, कभी भी बाहर आप कहीं भी ले जाते हो बच्चों को पार्टी में या कहीं भी, तो हम हर बार ब्रश तो नहीं कर सकते। स्वीट और सब, अब तो कप केक्स चॉकलेट्स वो सब तो खाने ही वाले, तो मेक अ हैबिट के एटलीस्ट दे गागल, या फिर उनको ऊपर सॉफ्ट खिला दो, वरियाली खिला दो, ताकि उस फाइबर से जो स्वीट है टूथ पे चिपका वो सब निकल जाए। सो मेक दैट हैबिट इन अ चिल्ड्रन फ्रॉम वेरी अर्ली एज।
Great. Thank you very much, both the doctor. There are still one or two questions which has just come. Soni Kumari is asking, when milk teeth is broken, then how many days it will come to take a back shape?
Yes, definitely. It is a routine. Majority of the parents are asking this question because when milk tooth fall down, usually the permanent tooth will come immediately after 15 days, or sometime it may come after 1 year. So I can say if it doesn't come up to 6 to 8 months, then not to worry at all. If it doesn't come up to 8 months, then you should seek for the dentist just for a checkup, but not to be a panic. And if it doesn't come after 1 or 1.5 year, then we need to do something, but that only depends on the case. And usually when milk tooth or a permanent tooth starts coming, it will fully come after 2 years. If once it started coming, it will fully comes after 2 to 3 years. So it will take a time. So not to be panic at all, just be relaxed. If you feel any unusual, just make a visit to a dentist. Definitely there is nothing disadvantage in that, but not to worry at all.
Great. And there is one question from Anshula Srivastav. How many times can we use dental floss in a day?
Dental floss, after, I always suggest कि best time to use dental floss is after meal. After both the meal you can use, because while brushing already हमारा जो भी फंसा होगा खाना वो निकल जाएगा, बट जो दो दांतों के बीच की जगह है वहां पे कभी कभी खाना फंस जाता है, तो वो ब्रशिंग से नहीं निकलता। तो आफ्टर मील जो भी खाना फंसा होगा हम गार्गल तो करने ही वाला है, बट वो गार्गलिंग से सारे निकलेंगे नहीं पूरा खाना। So we can use dental floss after meal, both the meal.
Great, thank you very much. It's been now almost 35 minutes and we are replying to all the queries, and thank you very much parents, students, teachers who have joined online. In future also this link will be there on Delhi Public School Bhopal Facebook. You can watch it anytime. You can share it with your friends and family members, because both Dr. Shalin and Dr. Pooja Shah have given a good information, and there are few parts of the information which any mother or father at home needs to take care about their children and the adults also. So thank you very much, Dr. Shah, Dr. Shalin Shah and Pooja Shah, for joining Delhi Public School Bhopal Facebook Live, sparing your valuable time and giving definitely a good information. We will certainly try to follow this at our home if we are not. And if we are following it, kindly follow it very strictly, so that Dr. Shalin Shah and Pooja Shah can smile on behalf of us very happily, and we can have a healthy teeth, and we can also smile very healthily and happily. Thank you very much. Thank you very much for joining. Thank you very much, technical team. Thank you very much, Facebook Live people, and we will stay tuned and see you next week with some other topic and other speakers. Thank you very much. Yali ho.